18% of men between the age of 18 and 24 suffer from erectile dysfunction. That's pretty shocking, actually, considering they're so young, and you can only imagine as you get older how many more men are struggling with this issue. And you're not alone. Obviously, there's so many people that are struggling with this. What I'm going to do is I'm going to share with you a couple of reasons why this is happening, as well give you a couple of solutions that you can integrate into your life right away so that you can start seeing changes. The two things that we want to address are your posture and your breath. So first, let's talk about the breath and why this is such an important component when we're dealing with something like erectile dysfunction. Your breath is basically your body's engine. It's what feeds all cells in your body with blood and oxygen. And of course, when we're talking about erections, you need blood flow to this muscle. So if you're not breathing properly, you're really limiting the body's ability to send blood and energy to all parts. The diaphragm is the foundation of the rib cage. When it's working properly, with the inhale it moves down in the body, with the exhale it lifts. Breathing diaphragmatically creates an internal heating system. It's almost like your body's furnace compared to breathing through the muscles of the upper chest, which is more like a space heater or a weak engine. So we want to turn on that body's amazing ability to feed cells properly so they can do our job for us no matter what age we have. And the wonderful thing is you can change the dynamic of your breath by understanding some simple fascia decompression techniques. The first step is to access and strengthen proper diaphragmatic breathing, and I'm going to show you one really simple way to do this. So first of all, what you want to do is you want to get a towel and you want to roll it up so that it's really nice and dense so that we have something that we can feel in the belly. And then what you're going to do is you're going to lie right on the belly button. Simple in its approach. You just place the towel, you slowly lower your body onto the towel, and you can stay up on your elbows. And then you want to spend 3 minutes here actively inhaling into the towel. This is going to teach you, first of all, where the breath should come from, but also the decompression that comes from 3 minutes in this position is going to help melt the adhesions that are blocking blood and oxygen flow and restore your body's function. Another component to erectile dysfunction is your posture. So this isn't so much an exercise, but an understanding of what's causing what and what you can do to address that lack of flow to the penis. So understanding how to be properly posturally aligned is really key to full function in the body. We should be standing with our feet directly under our hip joints, equal weight on both feet, and we want 60% of our body weight on our heels. The reality is most people are standing tilted over to one side or with external rotation, and what this is doing, it's blocking those roadways for the blood and oxygen to get to the penis. This is one thing that you really want to be aware of, and the more you can choose to stand with proper postural foundation, the better the flow is overall. So I don't mean to sound rude, but if you're standing like a duck, your dick don't work. All you need to get started is these two things. Learn proper diaphragmatic breathing to turn on your body's engine, and also understand how to properly position yourself so that you don't block any major channels for blood and oxygen flow. If you would like to see more videos on this topic, like and comment below.